we mentioned that racial inequity can present itself as access to nutritious foods or the lack thereof. Today, we hope to further develop why nutritious foods are harder to access in predominantly minority communities and what we can do to help. We also discussed how income inequality ties with race when it comes to a lack of access to healthier foods. Low-income neighborhoods consist of families who tend to work more than one job or work long hours to be able to provide for not only themselves, but also spouses, parents, children, and others. To be working for long periods of time, making a trip to a high-end grocery store that doesn't fit well into one's budget isn't realistic or attainable. These individuals instead have to resort to local convenience stores and markets who, for a cheaper price, sell foods that aren't as healthy as supermarkets and grocery stores farther away. These sorts of diets often consist of lots of sugar, salt, and fat, while being low in fiber, vitamins, and minerals, such as fruits, vegetables, and whole grains. This type of diet is a leading cause of type 2 diabetes, which disproportionately impacts communities of color, especially African American, Latino, and Native American communities. According to the Union of Concerned Scientists, members of these communities are about twice as likely as whites to be diabetic. They face higher diabetes-related mortality rates, and they suffer disproportionately from complications such as kidney damage and lower limb amputations. While diabetes is a health-related issue, there are similar barriers preventing individuals from receiving adequate care similar to that of being in a food desert. This can be a lack of access to transportation, insurance and money, as well as not having the time or resources. However, this doesn't touch on how unhealthier foods are often in the form of fast food restaurants like McDonald's and Burger King, as well as lower-end, more affordable convenience stores that don't always sell fresh produce. They can be ideal for low-income communities of color because while providing cheap, quick food, they also provide employment. This occurs in communities that are food deserts, meaning they have limited access to a variety of healthy and affordable food. The USDA found that in all but very dense urban areas, the higher the percentage of minority population, the more likely the area is to be a food desert. Their study included poverty rates, population receiving public assistance, minority populations, population with less than a high school degree, and housing units with no vehicle available. For each characteristic studied, the percentage of people and households was frequently higher in food deserts than in non-food deserts. The USDA found that median family income is around 18% lower in rural food deserts than in non-food desert rural tracts, which is an example of income inequality in food deserts. They also found that this disparity is higher in urban food deserts than in urban non-food desert tracts. In regards to transportation, it was found that comparisons between food desert tracts in other areas suggest that the disadvantaged status of food deserts is also reflected in lower vehicle access rates. However, individuals who live in rural food deserts have a smaller difference in personal vehicle accessibility when compared with other rural areas. This means that the disparity in access to vehicles is more prevalent in urban areas. While buses may be accessible, they are more time-consuming and some individuals may need to take more than one bus to get to a supermarket or grocery store. A study completed by the Johns Hopkins Bloomberg School of Public Health about Baltimore was used to compare neighborhoods that were predominantly black and predominantly white as well as their access to healthy foods at 226 different stores. The study found that 43% of predominantly black neighborhoods and 46% of lower-income neighborhoods were in the lowest tertile of healthy food availability versus 4% and 13%, respectively, in predominantly white and higher-income neighborhoods. It was concluded that predominantly black and lower-income neighborhoods have a lower availability of healthy foods than white and higher-income neighborhoods due to the differential placement of types of stores as well as differential offerings of healthy foods within similar stores. While poverty is an important factor in food deserts, it is also entangled with race and where these demographics are clustered. So what can we do to provide equitable resources that will increase access to healthier foods? The answer may seem simple, but building new grocery stores in communities without them isn't an easy solution. Those stores would also need to be affordable to bring in consumers, but also must bring in enough income to remain open. One solution is community gardens, where individuals can work together to grow their own produce. Community gardens don't have to be big, and urban gardens can even be placed in rooftops of apartment buildings if there's not much accessible land. Mobile produce trucks are also a simple means of bringing food to the people, especially if it's on a schedule so that people in the community can buy healthy foods weekly for their families instead of making long trips every week. Considering the amount of convenience and corner stores in these neighborhoods, Requiring them to provide healthy and fresh foods for the consumers would also provide easy access for individuals who have to make long trips for fresh produce. These solutions all aid with affordability and transportation inaccessibility. But what can we do about the many fast food restaurants that tend to be prevalent in these communities? From a young age, diet habits are formed in children and even families. It's easy for fast food to become a large part of those diets. Nutrition education is important for parents, children, and those who serve food to ensure that a balanced, healthy diet is being provided to everyone and not only those who have the resources to learn more about what they're feeding themselves and their children.